Hello and welcome. And today I'm very delighted to be speaking once again to Claire, who is one of our Talk Health members, but is also somebody that has helped with us before. Oh, you've got a visitor on the subject of now. See, I've forgotten it already. Lichen or lichen.
Lichen Sclerosus.
Lichen Sclerosus. My cat will be coming past in a moment, don't worry. And we are doing this, the whole awareness, in conjunction with the British Skin Foundation, who are supporting us with their experts on an online clinic. So where we've got a panel of experts who can answer your questions. So welcome, Claire.
Thank you. Thank you for inviting me. It's very important to raise awareness.
So Claire, we are going to talk a lot about the condition, the disease, and how it's affected you. But what I will stress is that it's affected Claire because she wasn't diagnosed in time in more of an extreme way. So we don't want anyone to be go, oh my goodness, but I think it's important to put it into context. As with lots of conditions, the sooner you can get a diagnosis and the sooner you can push for a diagnosis, it's really important, as Claire will show. Claire isn't a medic, so just to be aware that this is an expert patient talking, not a medic, but I'm sure that you know far more than many of the experts, Claire, now that you've had to, well, I suppose you've had to understand it so much yourself. And then we're going to talk about, which I think is very important to people, how you manage on a day-to-day basis living with this condition. And then finish off with looking at all the amazing stuff that you are doing to support people with lichen sclerosus. So Claire, if you'd like to tell us a little bit about yourself.
Yes, I'm 51 now. I was diagnosed with both lichen sclerosus and vulvar cancer back in 2016 when I was 43. It was quite a shock because obviously I hadn't heard of the cancer or the skin condition before. And it wasn't until I looked back and talked with my dermatologist that it was obvious that I'd had lichen sclerosus from the age of about 5, from what I can remember. I remember sitting at that age, we used to sit on the floor quite a lot in assemblies and reading time, and I found it quite uncomfortable to sit on the floor, quite sore. The vulva was quite itchy. I was always called a fidget by my mum and the teachers because I wouldn't keep still. So that's really the early signs I had. And as I got older, about 9 or 10 years old, my mum would hear me crying, actually screaming sometimes in the bathroom because of the pain of where I'd scratched and caused tears and sores. Obviously, going to the toilet, the urine stung so much that I didn't want to go to the toilet. So a tiny little drop would sting and I would just scream. So she took me to see a GP. And at the time, he never looked. He just said from the symptoms my mum and I were talking that it was burning going to the toilet. So obviously, as it wasn't explained properly, he just assumed it was cystitis. So he gave me medication for that and sent me on my way. It didn't really help, and it continued. But because I was quite young and being a male GP, I was quite embarrassed. So I hid it from my mum, said I was better. As the years went on, the symptoms disappeared sort of in the early sort of teens. And in my early 20s, it sort of came back again, itching, sores. I did go back to the GP in my 20s. I went twice actually then, saw 2 different male GPs, both never asked to look, both just assumed from my symptoms when I said I was itchy and saw it was thrush. So I was given thrush treatment, again, didn't really help. I continued to self-treat as well, bought more thrush treatments over the years, tried all different creams that I'd seen and done a bit of research myself. Again, nothing really helped. During that time, I'd had smear tests and obviously I had 2 children. Nothing was ever said, so I thought everything was fine. I continued on. It was hard, but you know, just thinking it's just thrush, like a lot of women are told and think it is. And then I got worse in my late 30s, so I went back again, and this time I actually saw a female GP, and she actually, for the first time, actually did a swab to test if it was thrush. And also did a blood test. Both came back negative. There's nothing wrong. She thought maybe the symptoms might have been to do with diabetes. So they came back clear. So it was just left as, oh, maybe it's early menopause. And again, sent on my way with nothing to help. So I carried on struggling along. And then I got a tear in the perineum area, which is sort of 6 o'clock sort of position, the vulva area. And again, I thought it was probably due to sex and that it would heal. But so I ignored it again, carried on self-treating again with thrush. And then I noticed after about a year that the tear was still there, and I even had a smear test actually during that time. Again, nothing was ever said by the nurse. The tear changed into like an ulcer in the January of 2016, and the ulcer again I sort of ignored and thought, oh, I can't go back to the GP. I'll probably say it's thrush, so I didn't. And then by the March, it grew probably double the size, and it got to the stage where you know, I couldn't sit, couldn't go to the toilet without feeling it, and it was hurting so much. So I went back to the GP again, saw another different GP again, a lady. She looked and said that she thought it was herpes, and told me to go to the gum clinic. I wouldn't have gone, and I was quite shocked by that. And I think she saw the shock on my face. So she looked again and said, actually, it could be something called vulva cancer. I'm going to fast track you. She said, please go. If you don't hear anything within 2 weeks, please come back. So I left, you know, the appointment quite shocked, really. I wouldn't have gone to the gum clinic. So if she hadn't have looked again and fast tracked me, I wouldn't be here today. But I did go. I had 3 biopsies done, and that was when I was told that I had vulva cancer and lichen sclerosus. I had about 14 months of treatment for the vulva cancer. I won't go into too much of that today, but that's quite unusual as well. But a few things went wrong. I had to have radiotherapy twice. I had 4 surgeries, lots of different complications with it, and it had spread to my lymph nodes, which then became stage 3 cancer. After obviously all the treatment, I was then put into instant early menopause, lots of side effects to do with nerves damage, going to the toilet, and also because of the radiotherapy, I was then diagnosed with lymphedema in my left leg, pelvis, abdomen, and vulva area, which has been also quite challenging. Obviously, still having to go through all that, I've still got the lichen sclerosus because there is no cure for it. So there is still a risk of cancer. And although I was in remission for nearly 7 years, unfortunately last year, actually May this time last year, I had to have another biopsy and surgery because the cancer came back. Hopefully I'll have some scans at the end of June, July, which will be hopefully saying that I'm again a year in remission. But, you know, going for what I went through, it sort of made me quite angry and also quite shocked at the lack of awareness there was anywhere. So because of all what I'd seen about other cancers and other conditions, it made me do what I do now, really, and one of the reasons why I'm speaking to you today.
And do you feel that having the LS was the thing that if that had been sorted out and recognised sooner, you wouldn't have then gone on to develop the vulvar cancer because of the connection?
Yes, I was told that in most cases, when lichen sclerosus is left untreated, undiagnosed, there is a high chance then of turning to cancer. There is only a small risk anyway, between sort of 2 and 5%, but that is mainly those that are left untreated and undiagnosed. So I know that if I was diagnosed with lichen sclerosus earlier, yes, I might still have got cancer, but I would have known the signs and the symptoms, and I would have gone a lot sooner. So then maybe it would have just been stage 1, where I would have just needed surgery. I might not have needed all the other surgeries and the other treatments I needed, which has given me a lot more of the side effects and affected my quality of life. So yes, definitely. You know, there is some research showing that regular use of potent steroids does lower the risk of cancer. So yes, I do believe that, you know, if I was diagnosed earlier, I wouldn't be sitting here now with having stage 3 cancer and only a 40% chance of living 5 years or more.
And also, I suppose then if you'd been diagnosed with it so much earlier, then you wouldn't suddenly have all of these things to have to deal with at the same time, which sort of goes on to the quality of life. Now, I know that you fortunately have managed to have a couple of children, which is obviously excellent news, but tell me a bit about the problems that you have with living with LS and what it means on a daily basis.
Well, like any condition, it is different for everybody. It's all individual. No one has any idea what it's like living with lichen sclerosus unless you have it yourself. And also those that have it, we all have it at different degrees. Some can have it mild, some carry on their lives without even knowing they got lichen sclerosus and actually get diagnosed accidentally when, you know, they're having another type of procedure doing. So, or you could have it to the end of the scale where it's quite severe. So it is very individual. But just because somebody has got it quite severe doesn't mean to say that everybody will. but quality of life, again, is different for everybody. But for myself, you know, it's a taboo subject as well. So it's something you have to deal with on your own quite often, because a lot of people are quite embarrassed to tell even family that have it, or friends, or even partners, because they don't really understand the condition very well. So it's hard when they try and tell somebody else about it when they don't know themselves. So that side of it impacts your mental health quite hard. And also you got, it's in the area where we have to sit, we have to walk, go to the toilet, have sex, have children. So it can affect, your daily life, or impact it quite heavily with some people. For me, because I didn't know what it was, made it, I think, harder. I could still have sex. Like I said, I had 2 children. I did end up having cesarean sections both times, not because of the ELS, because I wasn't aware I had it, but for other reasons. So I know that maybe if I did have a vaginal birth, maybe the lichen sclerosus might have even got diagnosed then. Definitely would have made it worse. But yeah, it does. It makes you think about what you're going to do that day. You have to wear different clothes. Even before you're diagnosed, jeans are uncomfortable. Sitting for long periods uncomfortable. You itch, sore. It affects your sleep. It can affect your day-to-day life for some people quite a lot.
And also, it's there, isn't it, in your mental health? It's there all the time, and then it affects relationships, because if you're having a bad day, how you then react to your partner and your children.
Yeah, definitely, because it's quite known for stress to cause a lot of conditions, especially skin conditions, to flare. So a lot of us in the LS community have noticed that stress can cause flares. So you're stressed about having more symptoms, and then it's like a vicious circle. So yes, it is hard, and because you can't really talk to anybody, or sometimes your partner can't understand what it's like. Also, a lot of people, not just myself, but there is that small risk of cancer, so that's always in the back of your mind as well. And and unfortunately, a lot of medical professionals aren't that well trained in lichen sclerosus. So again, you've got the added sort of stress of that, knowing that trying to get an appointment, trying to get seen, trying to get referred, trying to have regular checkups, which you should have really if you've got lichen sclerosus, isn't always easy, because they're not all trained. So it's quite hard really. So you've got the worry of knowing if they they look properly, and they can diagnose LS.
Mm. And what would you say that you're sort of, I was going to say, how do you manage it? And also, what would you recommend to people if they have similar symptoms?
Well, for starters, I recommend everyone checks their vulva at least once a month. We're told to check our breasts and other parts of the body, the vulva as well. Check it once a month so you get to know what it looks like, so you know what's your normal, because they don't all look the same. It's no different to our face or our fingerprints. They're going to be different for everybody. So just make sure you know what yours looks like. So when you do look, if you notice anything different, any white patches, any sores, blisters, any lumps, any ulcers, that you get checked out, you get seen. And if the GP is not sure, then ask to be referred. Again, that can be complicated. Is it a gynecologist? Is it a dermatologist? In my experience, I would ask to be seen by a consultant dermatologist. And then, if you are diagnosed, then the treatment at the moment is for topical steroids, potent steroids to be used. Quite often, it's once a day for a month, then every other day for a month, and then twice a week. Again, that depends on you and what the doctors suggest to do. Some people have to take it a lot longer than 1 month, up to 3 months. Again, we're all individual, so the strength and the frequency of steroids will change, but it does often need to be potent steroid, and the ointment is better than the cream because the ingredients are different, so there's less irritation. And also emollients are very important with how we wash and what we use, the barrier cream, all these are important. So again, why really you need to see a specialist that can help you.
Gosh, I mean, it's just so important to be aware of your own body once again. And I think, you're absolutely right. We're all told about checking our breasts. Why on earth aren't we told at the same time, check your vulva?
It's because it's rare, they don't care, basically. It's a rare condition. They think it's a rare condition, which a lot of doctors are saying that it's not rare, it's just rarely recognised and diagnosed. Again, the age doesn't help, I don't think, because it is mainly to be young or to be older. And I think because it's mostly menopause sort of age, my opinion I think the reason why more are diagnosed at that age, because it takes that long to get a diagnosis. and maybe other things going on which make you go to the doctor more, and maybe you've got menopause symptoms as well, which takes you to the doctors as well. But yeah, it can be any age. A lot more are getting diagnosed in their 30s and 40s now as well. But I think because the age thing is a bit more tunnel vision for doctors, they think you've got to be at a certain age and that you're too young. Same with vulvar cancer, just because the most common age is over 70, they seem to sort of think, oh no, you can't have it, you're too young. But just in the UK, the youngest age that I know of is 17 years old. So you can't rule out age on any condition really, because just because it's rarer doesn't mean to say it's not going to happen.
And I mean, presumably, well, I know that you're very open with your husband and discuss it. And would that be one of the main things that you suggest, is that people do talk? Because you do need to have some support when you're going through this, that you feel that you're not going mad, there is something that's not right with you, and you do need that support to enable you to carry on pushing forward for a diagnosis.
Yeah, definitely does help. So I never really spoke to my husband during the time of the symptoms. It wasn't until obviously I was diagnosed, and then we both realised, what I'd gone through over them years, and and it's difficult. But you need to tell your husband what it's like, how it is for you. Try and explain to them, how it makes you feel, and that you want to have sex, but sometimes you can't because it's going to be painful. So you need help with lubricants, for example, or dilators. Just make sure that they're aware of the symptoms and what you're going through. It also helps to tell your family members, because although they don't know it's hereditary, it is quite it's about 15% in families are known to have it, and they're not going to know really, because so many people don't talk to their mums, aunties and sisters and brothers about it, that they don't know. When they do, it turns out, oh yes, I've had it. And an auntie might say, yeah, I've had it, or even a sister, yeah, I've had it. But they both don't talk to each other, because boys and men can get lichen sclerosus as well. And it can be on any part of the body. It's just more common to be in the vulval anal area.
And then, but since your diagnosis, you've now gone on to, you've created a website, you've created a community, you've created lots of information. Could you tell us a little bit more about that?
Well, yes, because during my treatment, I had a lot of time waiting around hospital. So I'd done a lot of research. I was looking on the internet, and there was a few charities doing some work, but they didn't seem to include lichen sclerosus or vulvar cancer very often. So that sort of made me quite angry, really, because I'm thinking, why? So I started really using my social media account on Twitter and Instagram to try and raise awareness. I already started a support group for vulvar cancer, and I found a UK lichen sclerosus group where I met Emma Norman, who I work with now. And there's 11,000 in our support group now for LS. And we just decided together really to start the website, start the Facebook page together. We do campaigns. We're both patient representative on a lot of different trials, and we just wanted to do something really, even if it was just to help one person. And from then onwards, I suppose, because I started working with British Skin Foundation and the Eager Pill, they both put my blog on their websites, which then got some media interest. And in 2017, I think it was, my story went viral. And from then on, a lot of people found me through that. And I just realised I'm helping people by using my voice. A lot of people are quite embarrassed to talk about both conditions. And you needn't be. We need to talk about it more. Breast cancer was similar to that years ago. People wouldn't talk about it, so we need to be open about the discussions of our vulva conditions and our care and treatment. And because of that, I suppose it's why I started doing what I'm doing with, with writing blogs for people and lots of podcasts. Like I said before, a lot of trials I'm involved in. I do some things with the BSSVD. As well as the RCOG, obviously other Macmillan and cancer research, anyone really that will listen and will help. I've worked with over the last 7 years.
Yeah, no, and I think listening to you talk about it, you're very matter of fact, very approachable. There is no, because I think apart from the embarrassment, people also feel shame with these things, as if you've deliberately gone out to catch it, for want of a better word, isn't it?
Yeah, that is, for both. Well, lichen sclerosus, a lot of people think maybe it is catching, but it's not. It's a skin condition. It's no different to eczema psoriasis. It's still a skin condition. And the same with vulva cancer, talking about the vulva and the vagina, people are embarrassed about and make fun of it. Even when my first story went viral, some of the stupid comments that were written underneath about it, but you just got to try and ignore that. And the more we do talk about it and openly discuss our symptoms and about talk, and shouting the word vulva and vagina, so that as easy as saying ears and nose. Hopefully in years to come that will happen.
Yeah, absolutely. And also you're involved in the trial that we're supporting as well, called MS Pearls, to get people to go on to a trial for people who have for LS as well.
Yes, that's been going on for a couple of years now, and myself and Emma are both patient representatives on there, and it's to do with the steroids, because again, with a lot of conditions, quite often different doctors will give you different treatment plans, and with steroids, there's quite a lot to prove really, I suppose, even with steroids, and a lot of misinformation about steroids. But with lichen sclerosus, it's different. It's not the same as eczema, for example. We only use a small amount and small area, so it's safe to use long term. It doesn't thin the vulvar skin, doesn't thin the skin like it does for other conditions. Even when you read the ingredients and the information on steroids, it's even said, that's changed slightly on some of them, but it used to say don't even use on genitals or on broken skin. And obviously lichen sclerosus, it is the genitals and it is broken skin. So, you just got to make sure you speak to your consultant really about steroids, so they can reassure you that they're safe to use. And also we're told different things as well, whether only to use steroids when you're in a flare, or you can see symptoms and then stop again and then restart when you've got a flare, whereas some doctors were saying use it continuously to help. So that was why Ros and the team, and we started this trial a couple of years ago to do with steroids. It's a randomised controlled trial proactive against and reactive therapy to steroids. So you're going to have half the group that will be using steroids regularly, like twice a week maintenance, whether you have symptoms or not, and you're going to have the other half that are only going to use it during the flare, and then see what the outcome is. So then hopefully we will get told then, all the doctors will be singing from the same hymn sheet to say that how we use steroids, whether it is only during flares or as maintenance dose.
And I think that we can't stress enough, how important clinical trials that are, really evidence-based, have got something solid behind them, helps patients, but also it gets the word out further again to clinicians about the condition and how it can be treated most effectively. I think it's just so important.
Yeah, I think that's from the LS community. I think that is one of the main problems, I suppose, is that we're all told so many different things, like what steroids to use, how often to use, how much. A lot aren't given really any information, just here's the steroids, on your way. And there's lots of misinformation in other support groups as well as on the internet about steroids. So, you just need to make sure that you speak to your consultant dermatologist to get, the information from them and not the internet, that steroids are safe to use, which you need to use. And, it's because quite often it's, LS is compared to eczema with steroids. It's not the same, because the vulvar area is different, LS is different. So just need to make sure that you're getting the right information from the right person and you do your research.
And I think also, and hopefully this will raise awareness for people that are, to use the word, they're fobbed off, that they've got, something else, they might have thrush. And if it keeps coming back, there's a reason it's coming back, and it could be because it's not thrush. It could be LS, for example.
Yeah, that's one of the things I was quite annoyed with, the fact that, it must be on the doctor's screen that I've been multiple times with thrush. So why didn't that jump out, like, let's have a swab and see if it is? That didn't happen until quite late. So there's lots of things that can happen, we can learn from. There is some online training resources out there, which I helped the Eva Pill with, and also with our COG have also got some online training. But unfortunately, healthcare have to show an interest in vulvar diseases to do that, really. So that's the main problem that we have, is that unless they show an interest, they're not always given the right information. Which hopefully why this trial, once it's over with, which will take obviously a couple more years, then obviously all dermatologists, gynecologists and doctors will all have the same information, because it's UK trial, and they will use that then, and then we all will be told again the same treatment plan.
Absolutely. Well, Claire, thank you so much for your time today, and I'm sure that you will have helped people just by passing on your experiences, and also obviously wish you really, really well for your tests in June and July.
Thank you very much.
Thank you.